not have altered or changed any documents in the medical record after you received the lawsuit in this matter?
No, I did not.
Did you review any hospital protocols, rules, regulations, bylaws, or guidelines after the lawsuit was received by you in this matter?
No, I did not.
In your position at University Hospital at the time that you treated Joshua Valdivieso, were you aware of the hospital protocols, rules, regulations, and guidelines that would govern a physician's treatment of a patient?
I was aware of them.
Are they in a written format somewhere, sir?
I'm sure they are. I don't have them in my office, or I don't keep them.
All right. As the chairman of the department, though, would you have some administrative responsibilities?
Yes, I do, and those records would probably be in the administrator's office.
I also asked you to bring certain documents which were generated relative to an investigation that was performed at the University of Wisconsin Medical School, Department of Human Oncology, involving yourself during the years 1996 and 1997. Do you have any documents in your possession that were generated as a result of that investigation?
No, I do not.
Were you ever forwarded any letters or documents by Philip Farrell relative to that investigation, or any decisions made as a result of that investigation?
I may have received some, but I certainly didn't save those. I can't recall specifically. But I have no records from there.
What do you believe you would have received from Philip Farrell?
Objection. You may answer if you can.
He was the dean of the medical school. I'm not sure what records he would have sent me. I don't have those. I certainly didn't save anything from. I left there 5 years ago.
What about Gordon Derzon?
He was the CEO of the hospital. Again, I have no records.
Were you provided any records by Gordon Derzon that you have recollection of, whether you retained them or not?
Objection. You may answer.
I can't recall receiving any.
What about David Ward?
He was the chancellor of the university, and again, I have no records. And I can't recall anything specifically.
Do you believe that you were forwarded any records by David Ward relative to that investigation and its conclusions?
Objection. You may answer.
I can't recall.
What about Dr. Scott Springman?
He's a anesthesiologist, or I'm not sure if he's still there. Again, nothing that I have.
What about documents from Lisa Burnett?
I don't know who Lisa Burnett is.
All right. What about documents from UW Provost John Wiley?
Again, don't have any recollection, and I don't have any records.
What about documents from Casey Nagy? Is it your testimony here today that you did nothing improper relative to the substantive matters which were being investigated by the University of Wisconsin?
Yes.
Why did you voluntarily choose then to reimburse them $15,000 to help defray the cost of the investigation?
Objection.
I actually can't recall the specifics of that.
You have no recollection as to whether or not you voluntarily paid money to the University of Wisconsin Medical School to defray the costs of the investigation that was conducted involving yourself?
Objection.
I can't recall the specifics.
Did you issue them a check for $15,000 at the conclusion of the investigation?
Objection. You may answer.
I can't recall.
Did you reimburse $5,815 for billings that were made to patients that were determined to be inappropriate?
Objection.
I can't recall. We had a practice plan that may have done that. I don't think I personally did that.
What about the $15,000? Was that from the practice plan as well?
I can't recall.
You had counsel that represented your interests in that matter, did you not?
Yes.
And what was the name of counsel?
It was... I'm blocking on his name right now.
Okay. While you were at...
Michael Wyden.
Okay. Tell me the position that you held, sir, at the University of Wisconsin Medical School.
I was chairman of the Department of Human Oncology and a professor. I had a named chair, and I think the Anderson chair.
Were you involuntarily removed from the chairmanship of that department?
Objection. You may answer.
Each year we had a vote for the chairs at Wisconsin. It's the faculty members. One year I did not receive a majority of the votes.
Were there allegations by your colleagues against you that you were administering treatment that was medically excessive and not warranted for billing purposes?
Objection. You know, I think, Ron, I'd let you go, as far as I think you should go in this matter, and I'm going to instruct the witness not to answer any further questions about what happened back at the University of Wisconsin. I mean, I think you've gone far enough in that regard. I don't think it's relevant. You've withdrawn your discovery request for that information.
Well, the discovery requests, Mark, that were withdrawn at this point in time for our specific strategy reasons in the case. That does not act as a waiver or preclude me. There is still pending claims that are directly relevant to that. I would ask your indulgence. I have one or two questions in this area, and then I'm done.
Repeat the question.
Fair enough. Could you please read back the last question?
Question, were there allegations by your colleagues against you that you were administering treatment that was medically excessive and not warranted for billing purposes?
Objection. If you know.
Allegations were made. Nothing was substantiated.
All right. And my last question on this issue, and Mark, I appreciate your allowing me to finish this area. Subsequent to this investigation that we discussed, did you receive any disciplinary notification or